Hello everyone. In this session, we are going to cover one of the COPD, that is bronchiectasis. In your university exam, you usually get a short question on the pathogenesis of bronchiectasis or its association, that is Carter-Jenner syndrome. So let's start the topic bronchiectasis. So it is one of the COPD, as I told you, that is chronic obstructive pulmonary disease, COPD bronchiectasis. So we know there are 4 types of COPDs. This is the last COPD I am teaching you. So I request all the students to watch all 4 COPDs at one shot in a binge watch so that you have a better understanding of all COPDs at one place. So I assume you have already watched chronic bronchitis, emphysema, asthma, and now here I am teaching you bronchiectasis. I taught you all the COPDs in a fixed set of headings, so I will teach you bronchiectasis also under the same set of headings only. So this is the overview which is common for all COPDs. So first of all, I will let you know the introduction, what do you mean by bronchiectasis. Then we will see the level of obstruction in the respiratory tract. Where is the exact level of obstruction? We will see its etiology, its pathogenesis, its type, gross, most importantly is microscopy, clinical features, and its association. One of its important association is Carter-Jenner syndrome. So you frequently get the question on the Carter-Jenner syndrome as a short or very short question. So let's start it. Before starting it, last time we are going to revise the respiratory tract, because without revising the respiratory tract, you cannot understand the level of obstruction. No, I am not knowing that you are watching it in continuity, all the COPDs or not. Okay, so listen. So first thing in the respiratory tract is the nose. After that, there is pharynx, larynx, trachea, bronchi, and then the bronchioles. First of all, we have primary bronchiole, then secondary bronchiole, then tertiary bronchiole, finally terminal bronchiole. Terminal bronchiole give rise to respiratory bronchiole, then alveolar duct and alveolar sac. The last 3 things together known as acinus. What 3 things? Respiratory bronchiole, alveolar duct and alveolar sac. So this is the same respiratory tract. You can see it here also. See the last 3 things together known as acinus. As I told you, the last 3 things. That is respiratory bronchiole, alveolar duct and alveolar sac. Now let's start the topic bronchiectasis. What is bronchiectasis? Bronchiectasis is a disease of bronchi and bronchiole. So see the level of obstruction. I request you to have a look on level of obstruction of all 4 COPDs. So in the first COPD, I taught you chronic bronchitis. In chronic bronchitis, the level of obstruction was trachea and bronchi. The second, I taught you emphysema. In emphysema, the level of obstruction is acinus. The third, I taught you asthma. In asthma also, the level of obstruction is same as that of chronic bronchitis. That is trachea and bronchi. And now I am teaching you bronchiectasis. In bronchiectasis, the level of obstruction is bronchi and bronchiole. That's why it is known as bronchiectasis. So what is the level of obstruction? It's bronchi and bronchiole. So what is happening in the bronchi and bronchiole? The bronchi and bronchiole get dilated. Why they got dilated? The bronchi and bronchiole get dilated because their walls become weak. Who's causing the weakness of the wall? The infection and inflammation. So see, this is a bronchi or bronchiole. Imagine this is either bronchi or bronchiole, primary, secondary, tertiary, terminal bronchiole. It can be a bronchi or any bronchiole. So what is happening now? There is obstruction in the lumen of the bronchi and bronchiole. Because of the obstruction, this is obstruction. Because of the obstruction, there is infection. You know, whenever there is obstruction, it attracts the bacteria, there is infection. And infection is leading to inflammation. So in the wall, there is inflammation. Because of the inflammation, there is weakening of the wall and the wall get dilated. So the dilatation of the bronchi and the bronchiole is known as bronchiectasis. So what is bronchiectasis? Say it again. So you can see this is bronchi or bronchiole. You can see this is the wall of a bronchi or bronchiole. So let's write either it is bronchi or any of the bronchiole. Okay. So now the story starts with the obstruction. Whenever there is an obstruction, obstruction leads to infection. And infection leads to inflammation in the wall. So in the wall, there is inflammation. Because of the inflammation of the wall get weakened, weakening of the wall. And because of the weakening, it get dilated. So the dilatation of the bronchi and bronchiole is known as bronchiectasis. So it is the abnormal and irreversible dilatation of bronchi and bronchiole secondary to inflammation of the wall. And inflammation is leading to weakness of the wall. Because the wall get weakened, they got inflamed. And they got inflamed, they got weakened, and they got dilated. The level of obstruction is bronchi and bronchiole, as I told you. That's why it is known as bronchiectasis. Etiology is obstruction. It is starting with obstruction. Obstruction leading to infection. Infection leading to inflammation. Inflammation leading to weakening of the wall, and that is leading to dilatation. So draw this flow chart. You can see it's a disease of bronchi. You can see these are the 2 bronchi. The 2 bronchi and the bronchioles. You can see the 2 bronchi, right and left principal bronchi and the bronchioles. So it's a disease of bronchi and bronchiole that get dilated. So what is the pathogenesis? I told you it starts with obstruction. Whenever there is an obstruction in the lumen, obstruction lead to atelectasis.